Supply is a fundamental concept in economics. Dr. Steve Stoller explains the theory of supply and describes what causes shifts in healthcare supply curves. He also describes aspects of supply for some of the submarkets in healthcare.
Law of supply describes how things get produced. And the most general version of it, the basic concept which accords with most people's common sense, is that there's an upward sloping relationship between quantity supplied and price, meaning the higher the price of something, a good or service, the more will be supplied, will be brought to market. People tend to be willing to work more when they get paid more. Everybody can relate to that. Well, that's a supply function, a supply curve that says the higher the price, the greater the quantity supplied. And the same marginal concepts underlie the supply curve as underlie the demand curve. Increasing marginal cost means the more you produce of anything, the more costly it becomes to do it. Why? Because you first produce things in the easiest way, and then it gets increasingly difficult. And it's the increasing difficulty of producing something which accounts for the increasing cost. So economists said with this relationship, this increasing marginal cost relationship, the only way more goods would be supplied, or services would be supplied to a market, is at a higher price. And there's your upward sloping supply curve. That's the theory of supply in a nutshell. The same way that we had other factors shifting demand curves left and right, other factors can shift supply curves. One of them is changes in technology. So breakthroughs in productivity have the function of shifting supply curves to the right, meaning more could be produced at any price, at any cost, than previously, because you had lower cost ways of doing things than before. There's a great deal of theory that underlies the upward sloping supply curve. Underneath supply is a theory of cost and increasing marginal cost, that producing an extra unit becomes increasingly expensive. And underlying that is a theory of productivity, which says it becomes harder and harder to produce successive units of a commodity or a service because you've run out of the easy ways of doing it. And underneath that is the available technology, the tools you use to produce anything. So when you look at a supply curve, what you're assuming is a given technology, a given state of the world with you have certain types of tools. If you get a change in productivity, meaning new tools that make your job easier, then you can produce more, you can supply more at the same price than you did before. Why? Because your costs have fallen, so you can produce more. So this would account for shifts in the supply curve completely analogously to demand, where we talked about elasticity of demand. You can talk about elasticity of supply. What's the shape of the supply curve? Is it very flat or is it very steep? And the same logic applies. If you have inelastic supply, meaning a steep supply curve, it means if you change the price, if you raise the price, you'll get very little more supplied. That describes inelastic supply. Why? Because with a given technology, the means of producing it, you can't get more out. And there are lots of good examples in healthcare of this. Elastic supply would mean if you raise the price, you get a lot more out. The curve is very flat. And this may describe other types of services in healthcare. People talk about healthcare industry. What they're talking about is all the players in the industry, or all the component parts: physicians, nurses, technicians, hospitals, clinics, technology, new drugs, into producing health care. The interaction of the suppliers and the demanders, the producers and the consumers. How they all come together to produce and consume health care. All of these together, looking at them, are the healthcare market, the healthcare industry. And they're all worth detailed examination. Each one has different characteristics. Each one has different elements in it. Inelastic supply describes very well the supply of physicians in the United States. And it's been cited as one of the major factors in why healthcare is very expensive here. If you raise the price a lot, you still couldn't get many more physicians, either new physicians out because of constraints on training, or physician hours supplied because of the constraints on the number of physicians. So even if you paid a lot more, you couldn't get more hours. You would have to get more physicians and physician hours, you would have to do something fundamental to change the technology of supply. How are physician services produced? Doctors have to be trained. To be trained, they need schools, they need certified schools, they need hospitals to practice in. This is all part of the production process, the production function for a physician. After a doctor's trained, they produce their own services in the sense that they can offer more or less services, depending on market price, depending on what they see as the reward for doing more. Well, all of these factors that go into the production of physicians and the supply of physician services are shaped by an environment, an institutional environment. In this country, it has to do with regulations around physician training. Some of it is based on state law, how physicians are certified, meaning the state offers the public some assurance that a physician is qualified to practice. And it's also shaped by the trade association for physicians, which is the American Medical Association, which is very much at the center of this system in terms of which medical schools it certifies on its own. So there's a system of certification for good reasons, it can be argued, to keep up the quality of education for admirable purposes, which has the function of keeping a constraint on physician supply. And you can look at other countries which have different educational systems for physicians, which are perhaps not as tightly controlled, not as tightly supplied, which produces more physicians per capita, and arguably a lower cost of health care for this factor alone. That's one element. Scope of practice is another area which is brought into this discussion. What it really means is that because of education training and regulations, different professionals in healthcare are constrained in what they can do. For instance, a nurse can't do everything a doctor does, legally, as a function of their training. Nurses are allowed to do certain things and to operate under doctor's supervision. There are other types of training that allow nurses to do more. For instance, if they're trained to be nurse practitioners, they're allowed to do more types of primary care. Physician assistants are a different kind of training that allows trained physician assistants to do a lot of things, simpler things, a doctor, less complex procedures. One other example I use is hospitals. If you want to build a hospital in a new area, you can't just do it. Hospitals also have to be certified. They have to be qualified as up to certain standards by many different regulatory agencies, which adds to the cost of producing a new hospital, and therefore supplying hospital services, raises cost. But there are lots of regulatory and compliance constraints. Quality has to be complied with. There are lots of examinations. So these all raise the cost of supplying new hospitals. If we use the example of health clubs, fitness centers, clearly a very elastic supply curve. The more the market will pay, the higher the price, the more will be produced of it.